Hi, how are you today?
Hi.
My name is Fiona. I'm a home hospice nurse.
Hi.
Hi, would you prefer if I called you Sharis or Miss Hartoonian?
Sharis is fine.
Okay, thank you. It's lovely to meet you, Sharis. So I'm here today to talk about home hospice care for you, okay, what we can do for you, and then the services that we offer to support your family through this time. And if there's anything you have questions about, then you just ask, okay? Ask as many questions as you want. So that's why I'm here, okay?
Okay, thank you.
Thank you.
So nice to meet you.
You too, you too.
By watching this video, you will be able to identify at least 3 roles and responsibilities of palliative and hospice care nurses, explain how hospice care affects physical quality of life, and discuss the emotional health challenges during hospice care for both the patient and their family members. We already saw the nurse explain one of her roles to this patient and her family member, to educate. You'll see a lot more examples of education throughout this video.
So how are you doing today? And I assume this is your wife?
Yes, this is my wife, Jenny.
Hi Jenny, how are you?
I am doing good. Thank you for taking such good care of us.
Oh, you're welcome, you're welcome. Yeah, do you have any pain today?
Yeah, I'm having so much chest pain.
Oh, I'm so sorry to hear that. So it's in your chest? What makes it worse?
It's just every time I breathe, I can't catch a breath.
Okay, and can you give it a number out of 10?
It's like
Okay.
9 out of 10.
Oh, that's awful. I see that they have you on a on-demand morphine drip.
Yeah.
Yeah. How's that working?
So it does work initially, but then there's a huge gap between when she can take the next dose, and when she actually.
Yeah, that's really difficult. Yeah. Well, we can certainly do something about that. Okay.
I just keep pressing it,
I
and it's
know.
not working.
Well, we'll definitely change those orders. Okay.
The nurse has made her first NANDA nursing diagnosis. Sharis has acute pain related to fluid accumulation in the lungs, decreased cardiac function, inflammation, and compression of nerve tissue as evidenced by a pain score of 7 or 8 out of 10, facial grimacing, and labored speech.
So the first thing I'm going to do is I'm going to increase how often you can press that pain pump, okay? Now, this might have some side effects, so you might feel sleepier, okay? But it also might make it a little bit more difficult to breathe. Your breathing might be a little shallower, okay? But if you ever feel like you can't take a breath, okay, you've got to tell Jenny straight away, and she's going to call me or call 911 depending on how difficult that is, okay?
Okay, thank you.
Yeah. And how are you feeling emotionally?
I'm scared. I'm terrified all the time. I feel like I'm gonna die before I can say goodbye.
The nurse made 2 more NANDA diagnoses: death anxiety related to perceived imminence of death and observation related to death as evidenced by deep sadness, fear of premature dying, and fear of the dying process. The nurse also recognizes that there is risk for ineffective breathing pattern related to fluid accumulation in the lungs, pain, respiratory depression secondary to narcotic pain medications.
What can I do to help with her pain or anything?
That's a really great question. So for pain, I'm going to just get behind you if that's okay. Thanks, because I'm going to show you this massage technique. Okay, are you okay to lean forward a little bit? And you can do this if it's comfortable for Sharis to be on her front too. You can like just rub her back gently. This feels nice.
Yeah.
Yeah, and then you can even just like tap a little bit like this, if that's okay with you. It doesn't hurt too much.
No.
Okay, because that will start to loosen up some of that fluid that might be in the lungs. Okay, so that's good. You can do this as often as it feels good. Try to do it sort of twice a day. She might cough more afterwards with the loosening up, but hopefully that will help. And any just massage, you can just relax. Anything. Just you can get some nice scented oils, and you can just massage and whatever feels good for Sharis, really.
Yeah, that felt very good.
Yeah, good. And then I've also got a list of guided meditations that are free to listen to, so you could listen to those as well. You could even listen to them together if you'd like. while you're massaging. That can be really helpful for relaxation and pain relief. Does that sound like something that would be good?
Yes, thank you.
Okay, great, okay.
Another NANDA diagnosis is knowledge deficit, related to acute illness and emotional states affecting learning, as evidenced by asking questions. Here the nurse is educating about the many ways to address end-of-life pain, not just with pain medications. Family member involvement can be very important, as we'll see a bit later.
Okay, so I was also reviewing your insurance benefits, and it looks like you might be eligible for acupuncture. Now, acupuncture is really great for like all sorts of different things. It can help with pain, but also anxiety and sleep, restlessness, things like that. Is that something you might be interested in?
Yes, that's
okay. Yeah, do you think that would be good?
I don't know where to start with all of this. There's so much to do already. There's so many medications she has to take. I don't even know who's prescribing what medication, how much we need to give. And then like she also wants to talk to the priest because then she's also concerned about how God is like doing this to her. She's also wants to talk to a lawyer about all of this. She wants to change her will, and then I don't even know where to start with this.
Let's unpack this a little bit. There are two NANDA diagnoses that the nurse recognizes here. The first is caregiver role strain related to significant care needs of patient, insufficient assistance, and insufficient respite for caregiver as evidenced by difficulty completing required tasks, fatigue, and concern about the family member. The second is spiritual distress related to feelings of alienation from God as evidenced by asking why God would do this to her and asking for a priest. Let's see what the nurse does in her role as a supporter and coordinator.
I know it's a lot. It is a lot, and it's a very difficult time, okay? But I'm here for you and for Sharis. I'm here for the family to make it easier. So we have lists of resources, okay? Lists of providers that we've worked with in the past. So we have acupuncturists who do home visits and take insurance. We have lawyers, we haven't vetted them, but we know that they do estates and wills, okay? So they'll come to your house. We also have a multi-denominational chaplain who's actually part of our team. Okay, so that chaplain, if that sounds okay to you, it might not be your exact denomination, but he's very aware of all of these kinds of circumstances. They can talk to both of you together or separately. And then we also have support groups as well that we organize for family members. So that might be a good time for you to talk to other people going through this, if that's something you'd like to do. And then lastly, we also have options for some respite care. So what that means is, you know, I know that you want to be together as much as possible throughout these last days, but also it's important that you have time to take a break. So that when you are with Sharis, that she can, you know, have the very best care from you. Okay, so we can also organize someone to come in if that's okay with you.
Yes.
Yeah.
I would like that.
Okay, good. And yeah, does that sound good to you? The last thing is that I always have my cell phone on me. Okay, and unless I'm actually with a family like I am right now, I will answer. Okay. And you can call me any time of day or night. Okay. There is no time of day that you cannot call. So just reach out. Okay.
After my initial visit, I visited Sharis until her death 6 months later. Her wife helped her every step of the way. Over time, Sharis became more accepting of death and got her affairs in order so she could enjoy her last months with the people she loved. Between our help and the support network she built, Jenny was also less anxious.
Fiona, thank you so much for coming this with and so much for Sharis that you're here.
Well, she was a wonderful woman, and I'm so glad that I got to know her. I wish it was under better circumstances.
Great. Thank you so much for coming. You guys have done so much. You guys connected us to so many resources and helped her manage her pain. You just walked us through all the steps that you did.
Of course, it's what we're here for, and I'm really glad that we were able to do that for you and make what's really, really difficult just that little bit easier for you.
So much.
You're very welcome.
Hospice and palliative care nurses are dedicated to their patients and their families. They coordinate care and intercede between family members. Providing palliative and hospice care challenges nurses practically relationally, and morally. Ultimately, they do whatever is needed to provide individually tailored and holistic care to relieve physical and emotional suffering.